I'm going to do a nasotracheal sectioning. So I have already checked the charts, checked the patient's ID band, and I have washed my hands, and now I have my proper gloving on. So I'm going to get the patient ready, and I'm going to go ahead and prepare my catheter tray. So I'm going to open it up, and I'm going to get my sterile gloves ready to go. That way everything is ready for when I need it. And then I have my lubricant, so then I can properly pour in my sterile water with the catheter in there, and then my lubricant. Then I will either put it on the lid of the tray, or I can also get a clean gauze and put it on that as well. So after that, I can auscultate the patient to make sure I check their SpO2, make sure I get all their vital signs down the before, and then I also will get the after vital signs. So I'm going to get everything set up here. So here I have the sectioning tubing here and the machine here. So I'm going to turn on the machine just to make sure everything is set to the proper measurements. So I'm going to leave it at 120 here. So it's at 120, and I'm going to stretch out the tubing and make sure everything looks okay. No kinks in it. And then I'm going to obstruct the hole, and I'm going to see where it lands at. I don't want more than 150 on the vacuum, because that can harm the lungs. So everything looks good. So I'm going to set that there. I have that ready to go. And before I begin, I always need to oxygenate the patient and hyperinflate their lungs. So here I have a cord that they have been using, and I'm going to connect it to the odontary breather mask. And I'm going to set it to the appropriate flow. So you always want to turn it to where the bag will begin to inflate. So once I notice the bag's ready and inflated, then I can get them ready to go. So I'm going to put the cord where it's not going to bother the patient. And I'm going to put that around their head and make sure it's not going to hurt them. I'm going to put it on. So as I'm oxygenating, I'm going to get my catheter ready. So when I do that, I want to make sure I have my sterile gloves on. So I'm going to dispose of these gloves, and then I'm going to wash my hands, properly sanitize my hands before I touch the sterile gloves. Now when I'm putting on these sterile gloves, I do not want to touch the outside of the gloves. It's okay to touch the inside of the gloves as long as it's, as long as I don't touch the outside. So once I get these on, then I can begin to do the suctioning, get the catheter ready. So I have the catheter here, and I'm going to kind of go out with the catheter to make sure everything's properly ready. It's no kinks in it too. And so I'm going to take it and plug it into the tubing, and you can start to hear a sound. And so then I'm going to occlude that hole to make sure it starts suctioning. So before we begin, I'm going to put some sterile water up the tube just to make sure it lubricates the inside of the tube as well. So I'm going to take the lubricant, and I'm going to go around the end of the catheter just to make sure that it goes down easily into the patient's nose. So I'm going to use one of my hands, my non-dominant hand, to remove the mask. And so here, the patient we didn't have the nasal trumpet, so you can always go in with either a nasal trumpet or without. So I'm going to take and place it in here. And I always need to make sure there's no obstruction into the nose. And I can place it down into the nostril very gently. And then if I get stopped and I notice it stops down in, like in the opening of the mouth, I can notice it stops, I can have the patient cough. So then once it's down there, I need a section less than 15 seconds. So when I'm done, I'm going to slowly remove the tubing. Once the tubing is out, I can always re-sanitize it if I need to go back into the thing. So the patient is good. I'm going to re-oxygenate the patient to make sure their lungs get the appropriate oxygen. And then I'm going to dispose of this catheter. So I'm going to wrap it around my hand, and I'm going to plug this off, and I'm going to pull this out, and I'm going to dispose of it with my gloves. So that way it doesn't contaminate anything like that. So once I have that disposed and the patient is properly oxygenated, and if I feel they needed to be on the oxygen a little bit more, I can leave it on them for a little bit longer. So I'm going to get the tubing out of the way, and I'm going to shut off my vacuum. That way it doesn't suction up anything else with it. And sometimes when you're suctioning up like the patient's lungs, the doctor may also have you get a sample. So there's another tubing that you can attach to it with the catheter to get that sample, and then you can take that to the lab as soon as you're done. So I get this tubing out of the way. Then after a little bit, I would come back and reassess the patient just to make sure the patient is okay. And I'm going to check their lung sounds. If they don't need to be on the oxygen anymore, I would properly remove them. And if they are weaned off from oxygen, then I'd do the appropriate devices to wean them down. So once I'm done, I'm going to shut this off. Once they're done with the oxygen, then I would dispose of the mask in the appropriate place, and then I would wash my hands, chart anything that I have done for the patient, and then we're good.